Hi, and welcome to the Behavioral Health News Spotlight and Excellence interview series, where we feature exceptional leaders and innovative healthcare solutions that are raising the standards of care in the behavioral health community. My name is David Minot, and I'm the Executive Director of Mental Health News Education, the nonprofit organization that publishes behavioral health news and autism spectrum news. Our mission is devoted to improving the lives of individuals living with autism, mental health challenges, and substance use disorders, while also supporting their families, caregivers, and the professional communities that serve them by providing a trusted source of science-based information, education, advocacy, and quality resources in the community. Today, we're speaking with Mary Brite, Chief Operating Officer at Outreach Development Corporation, a nonprofit organization that provides residential and outpatient behavioral health treatment to youth, adults, and families, and CASAC, or Credentialed Alcohol and Substance Abuse Counselor Services in New York City and Long Island. I'm also proud to say that Mary is a valued board secretary at Mental Health News Education. Mary, thanks so much for being here today.
Thank you for having me, David. I'm very excited about our conversation.
Yeah, me too. So to start our conversation off, let's acknowledge that behavioral health organizations face change all the time from
Yes.
both internal and external pressures. So in your opinion, how can they keep things steady and stay focused on their mission? And what kinds of leadership approaches or mindsets help teams guide staff through these uncertain times?
I think that this is a very pertinent question, particularly with the environment that we're in now,
Mhm.
post-COVID world. And I think that one of the biggest shifts that leaders have to make today is recognizing that change is no longer an occasional disruption. It's the environment, it's the operating environment, right? So behavioral health organizations, we are navigating regulatory shifts, workforce pressures, evolving reimbursement models, and rapid technological change. Because of that, stability can't come from things staying the same, but it does have to come from a clarity of mission and a strength of structure. So there's a concept often discussed in futurist thinking, the acceleration of change. It's described by John Smart. He does good work in this area. And it suggests that as systems evolve, change happens faster and more continuously. And in many ways, behavioral health leaders are experiencing exactly that, actually. It means we can't treat change as a temporary phase to get through. I know I've been guilty of that in the past. And I think in the past, it sort of has been that way. Like, this change is happening. We're going to get through the change and we're going to land in a place of stability. But it's different now. And we have to design organizations that are capable of adapting continuously. So just some interesting information. I read that a farmer in 1600s used tools that were almost identical to a farmer in the 1400s.
Hmm.
So back, ancient times or, pre-modern times, people had generations to learn and perfect the tools that they used. With the industrial age, there were more change than in previous generations, but they still had years or decades to adapt. Interestingly, for us in the technological age, some technologies introduced during a person's childhood might be obsolete by adulthood. Entire industries can transform in 5 to 10 years. We saw that with COVID in our field. I know for us, COVID came that I feel like it was like March 20th. And within a week and a half, we were doing telehealth, which we hadn't done before. We had to adjust quickly. And then new tools and platforms and processes appear in months and not decades. So it's really for leaders, we have to be mindful of providing both operational clarity and emotional steadiness.
Mhm.
And I say that because I think we're all swimming in the same water. So the leaders aren't often enacting the change. The change is coming externally, and they have to receive that change, be able to receive that change, and communicate it down to staff without showing their own, what are we doing here? They sort of have to be able to show an emotional steadiness so that they can give staff clear roles, clear systems, maintain a strong understanding of mission. Structure creates safety during uncertainty. And when people understand the purpose of the work, they can absorb change without feeling destabilized. So in many ways, the leader's role is to anchor the mission while allowing the methods to evolve.
Sure. No, that's so true. And I guess sometimes it's hard to keep your game face on when big change is happening.
I think so. And I think also when there's change with uncertainty. So if we have, we don't know what's going to happen next, but we know something's going to be different. Yes, leaders need to keep their game face on and to be able to help staff. Right.
Sure. So as you know, and anyone in the industry, staff turnover and changing roles are challenges across the healthcare industry. What strategies have you seen work well for keeping staff engaged, helping them manage stress and challenges, and keeping teams connected, especially with ongoing hurdles like new regulations, shifting funds, or changing client needs?
I think that workforce pressures are really the defining challenges in behavioral health right now. I think that's pretty understood throughout behavioral health fields. As demand for services continue to rise, workforce supply has not kept pace. And because of that, organizations have had to become very intentional about how they support teams. I really feel that the most important strategy, and I do think it's a strategy, is listening. So it's listening strategically, not just to sort of do active listening. We're all taught to actively listen and let folks know you're listening to them. But we need to treat listening as a strategic practice, not just a courtesy. It really does improve both morale and decision making. You can get information from data, but the qualitative insight that you get from staff really helps leaders understand what's happening day to day. I think also communication, right? So you're receiving information and then communicating information out. The challenge is in times of uncertainty, silence can breed speculation. And speculation can take people's minds to wherever their own framework is. An example is, I remember once coming back from a vacation, and I was in one of my programs and I saw a client. He said, I haven't seen you in a while. And I said, oh, I was on vacation. And he said, how was Florida? And I hadn't gone to Florida, but in his mind, vacation equals Florida, right? So he just landed on Florida. And I think we need to remember that that happens for us. If there's a vacuum of information, we will fill the gaps in. Human beings do this. So transparent communication, even if we as leaders are working through solutions, it builds trust and it helps teams feel included rather than uncertain. And I'd like to add two other elements to that. One is that I really like to frame challenges through, you may have heard of it. It's a model of just knowing where to put your energy, basically. And it's your circle of control, your circle of influence, and your circle of concern. And it has decreasing ability to control what's happening as you move out of the spheres. It's usually shown as a circle and a bigger circle and then the biggest circle. And if we can stay in our circle of control, we are more likely to not only affect change, to stabilize ourselves. If we sort of try and move in our circle of concern, all of the things we're worried about, the larger environment and our personal life, but that we have no control over, we really might find ourselves struggling more. So the mindset can be really helpful in maintaining resilience. And that word will come up again. And then the last thing I'd like to say is we have to be mindful that change fatigue is very real. We are in continuous change culture now, and leaders recognizing that change fatigue is important, particularly for behavioral health staff, because they're balancing organizational shifts and all the things we want and need from them, while also managing emotionally demanding client work. And so it just can be very frustrating on a human level, right? So ultimately, staff are more likely to remain engaged when they feel heard, they feel informed and connected to the mission. They know what they can, where they can enact real change, where it might be frustrating, and then for us understanding that this is not easy for them, and it's not quite, a training doesn't fix it.
Mhm.
you know
Yeah, I wonder, are any of these challenges exacerbated by remote work?
I think they can be. I say we're 6 years post-COVID. I think we're all used to remote work, but just think about it. It really was when COVID came, it was, you still have to do this work, go to remote, and you're going to do telehealth. And then telehealth and remote work, not even behavioral health, remote work in general, was sort of going to save the world and everybody's happy and more productive and everything's great. And then we started seeing fractures and no, everybody needs to get back to the office. And then there was a lot of negotiating, right, between workers and leaders. Well, I'd like to figure out how I get to work a little bit remotely. And leaders saying, well, we kind of need you in the office. I guess what I'm saying to you is I don't know that the change, we're still in continuous change with that also. And I do think it adds another element.
Yeah, absolutely.
Yeah, challenging. Yeah, very,
Sure.
very.
So on another topic, with new reimbursement models, integrated care expectations, and rapidly changing technology, as you mentioned, how can leaders adjust their strategies in ways that strengthen care and support staff rather than creating disruption?
Okay, so healthcare and particularly healthcare, behavioral healthcare, is entering a period of significant structural change. We'll get information one day, and the next day they might say, "Oh, just kidding. We didn't mean that." Or we're going to be doing this, but we don't know when and we don't know how. And we sort of have to sort of put that in our brains, understand that's the world we're living in now, and still strengthen care quality for our clients and have staff effectiveness. We don't want to disrupt them. So I would say the challenge for leaders is making sure that these changes that come our way strengthen the mission rather than causing unnecessary disruption. So one way we do that is focusing on structure and systems. It gives people something to hold on to. I definitely believe in strong systems and that they create a stable foundation that allows organizations to innovate without chaos causing. When roles and workflows and expectations are clear, when you're introducing new technology, right, or integrated care models, it becomes much easier for staff to absorb. You already have a framework that you're sort of putting this new idea or method on top of. I would say another key factor is helping staff understand the purpose behind the change. So when reimbursement models shift or a new technology is introduced, it's easy for those changes to feel purely administrative, that like we as leaders are saying, you must do this, and this is an administrative function. When we have to be able to connect those shifts back to care quality, this matters to our staff. How integrated care, say, for example, improves outcomes, how we can use data to measure effectiveness, and how technology can ultimately support clinical work. So I think connecting it now, I am not saying that every staff member will be like, oh, I understand now and fully agree. I do think you have folks, you know, people don't go into behavioral health to think very much about data and technology. But it's the reality of the world we live in now, and it has a lot to offer. So I do think because this isn't something staff may lean into right away. I think listening, again, I go back to listening, plays an important role here. Staff often have very practical insights on how systems can function in real life, and having that feedback loop allows organizations to adjust strategies. I really think in this area, you need to tie the innovation to our mission, and then to have strong systems that keep our care delivery strong rather than disrupted. But I also want to caution, I think this takes time. I don't think this is a light switch where everyone just jumps on board. I think you're changing hearts and minds with this. Particularly in our field, this is human services. People went into this field to work with other people. And so I think it's a challenging one. I think we're mostly on board. I think everybody gets sort of why we need to do it, but when it comes to practice, I think that it's definitely something that may take a little bit more finessing, as you move staff towards your goals in this area.
Sure. That makes a lot of sense. You mentioned chaos. What core elements or pillars help a behavioral health organization stay strong during uncertain times? And can you share any examples from outreach where these pillars were really tested and held up well?
Yes. So I'm going to say mission clarity. So for outreach, that is, we take care of clients. Building healthy lives is our tagline. We take care of clients, and after clients come staff. I would say, and I'll elaborate, but I would say structure, having clear role delineation, communication, I've spoken about. And then I think also organizational culture, a culture that values collaboration, listening, shared problem solving. What you're seeking here is resiliency. Change is going to keep on rolling in. Out in the past 10 years, I've been with outreach for, oh gosh, I think 26 or 27 years. I've never seen more change than in the last 10 years, just never. So it sort of started with Medicaid redesign, but it was just a little. Then COVID came, huge change. And then internally in our organization, we had a significant leadership change twice, I think, in 10 years. So I think that if you come back to the core mission and that the work never changes, no matter what they need from us. Okay, today they would like us to gather this information. Now they would like us to do this survey with the clients. Oh, now they want us to do that same survey, but every 6 months with the clients. Funding's changing. All of these things. I think that if you come back, well, what is my North Star? That's what I call my mission. What is my North Star? And you stay oriented toward that. You're guided for good decision making, even as programs, regulations, service models evolve. And then you want to say the structure does this change our structure? Does it change our systems, our role assignment? Structure is not the opposite of flexibility. I really like structure because I feel like once the hard rocks are in place, what I call the big rocks, you have all this room in between to be flexible, and it allows us to adapt more effectively, and therefore be more resilient. What happened within outreach, staff had to get used to different leadership styles, like rapidly. And I call 10 years rapid because we have a large number of staff who have been with outreach for a decade or more. And they had to sort of say, oh, this is your priority. Oh, okay. And now this is the priority. And, they've done a fantastic job. Really, it's amazing that because I believe our staff stays focused on our clients, they're very clear on our mission. They are able to weather it. I'm not saying it's easy, and I'm not saying they don't sometimes falter. But nothing distracts from we help clients. Whenever we get jumbled up, if I'm speaking with other leaders or with the staff, and there's all these details, and well, what about this? And is this going to go? We have to pull back and say, you know what we do here? We help clients. And that reorients us to exactly why we're here and what we do. And that involves the communication, right? So you got to stay regular communication, program updates. It helps all of us together as a team stay aligned, even during periods of change, even significant change like leadership turnover. Um, and then I would say that it's important to have a culture within your organization that values collaboration, again, of course, listening and shared problem solving. That part, that shared problem solving, it's easy to say, it's harder to actualize. There has to be a lot of trust. I have to have a lot of trust in you to say, I cannot figure out the solution to this problem. And you have to have a lot of trust in me to say, well, here, let me lean in and help you. But organizations that can build collaborative teams have staff that feel more supported and connected to the mission. And that means they're more capable of navigating uncertainty together. So the pillars, I would say, are mission, structure, communication, and culture. I think that creates the foundations that allows organizations to adapt while remaining stable. We know adaptation is really the key to all of it.
It sounds like at Outreach, at least, that is one of the reasons why you have such great retention there.
You know, I really think so. I mean, I think we hire people with heart, and I will say, all of this other stuff is super duper important, but that's number one. I need people who have a heart for our clients. And not to say it's perfect, and not to say people, don't get frustrated about things, legitimate and, stuff that's just their own perspective, but, from a high level.
Sure.
I think that we're an agency with heart.
Yeah. Just curious, anything that you've spoken about these pillars specific to substance use disorder treatment versus mental health, or it's kind of just,
I want to say to you, it is the same. I don't see a difference in terms of navigating change and continuous change, which I really believe leads to continuous adaptation. We're asking people to just always be flexible. I don't think that there's a difference between SUD or OMH. I don't see that. No, sorry, I had something in my brain, but it just flew out the window.
Yeah. So, I mean, after everything we've discussed, what gives you the most hope about the future for behavioral health organizations and their ability to stay mission driven and effective through all these times of change?
Well, I will say the beautiful thing about behavioral health, what I do love about it is that, we are change agents. We help our clients change. We show them that they can become more of themselves as they change. It can be challenging for us because the work is so hard, the emotional toll and the administrative demands. It is hard. But we are change agents, and I think we are very well equipped to meet the demands of a continuously changing environment. And what gives me the most hope is the resilience and the dedication of the people who work in our field. They don't get paid all the money in the world. They do need to have, there are different levels of education, but they really need to be moving towards that advanced degree. This is not inexpensive in today's environment, and they don't get paid a lot. So I really just think so highly of people who choose to help other people as their work. Despite the pressures that our field faces, growing demand, workforce shortages, ongoing regulatory complexity, there is an incredible commitment among our providers to continue improving care for individuals and families. Mental health and substance abuse challenges are growing. Communities are increasingly recognize the importance of this work, and that actually creates opportunities. So I'm enthusiastic about that also. I think the movement towards integrated care is really right on. I worry a little. My hesitation is that we have so many good ideas coming out. I mean, just think about, in 5 years, some things are obsolete. We have so many great ideas coming out. that it can be challenging to not have scope creep, to sort of land and proceed in that direction, and not try and do everything at once. But I do think that organizations that invest in adaptivity will be well positioned in the future. Again, stability and adapting are not opposites, they complement each other. If an organization has a clear mission, strong systems, open communication, it can evolve without losing its purpose. I really think that in many ways, the future of behavioral health will belong to organizations that design resilience intentionally rather than improvising it. I believe many organizations, including outreach, are already moving in that direction. And I think that, I worry. I'll be frank. My worry. I know we're ending on a happy note, but I'll tell you, I'd love for the education programs. They're probably already working frantically on this, but this idea of when I went to social work school, we really learned how to be with clients, and it's all we wanted to do. And they said, just remember, 50% of your time will be spent in administrative work. And now I would say to them, it can't be, we're going to teach you how to work with clients and you'll have administration. I think that programs need to be giving foundations for the work with the humans and also the administrative demands. But I think we will. And we have a dedicated, passionate workforce. So I think it will happen.
And it's all about building healthy lives.
And it's all about building healthy lives at Outreach. We love it.
Well, I want to thank you for your time, Mary. It's been a pleasure speaking with you and learning more about the important work you and your team are doing to strengthen behavioral health care, especially at Outreach.
Oh, thank you.
And to those watching, if you found this conversation valuable, I encourage you to visit behavioralhealthnews.org, where you'll find a wealth of information on important mental health and substance use disorder topics, including in-depth articles, resources, and more interviews with leaders in the field. You can also subscribe to receive our weekly newsletters and quarterly issues and stay informed about the latest developments in behavioral health care. So once again, thank you for joining us today, and stay tuned for our next installment of the Behavioral Health News Spotlight and Excellence interview series.